Good morning, ladies and gentlemen. Sorry, I am not Anton Emanuel. I am so transformed. I am Giulio Del Popolo. I come from Italy. Unfortunately, Anton last minute was not able to be here. And I take part for this multi-century study. This is a European study. And we have about 10 centers in 7 countries. And as a clinician, my first curiosity was if our patients are enough able for new electronic innovation, and at the same time, if the electronic innovation works well to solve bowel management. What do we know about spinal cord injured patients is that the management of bowel and bladder are the most affecting their quality of life more than walking. So this was the system. I think that many of you know this system. That is the Navina Smart. Is the first electronic transanal irrigation system. And what you know from literature is also from Cochrane that the only treatment that gives some evidence of result is just transanal irrigation. We have some experience with homemade in 19 and also in the last 10 years with a manual system that now is used all over the Europe. So this is the first electronic. The primary endpoint, these are results, the preliminary results at 3 months, then we have also results at 12 months, but we are analyzing because the study now is closed. So we have these 3-month results about NBD score. We select all spinal cord injury patients with confirmed NBD, and usually the criteria was that they must have an NBD more than 10. It means with a moderate or severe NBD score. And we enrolled 89 spinal cord injury patients that must be at least 3 months after lesion, traumatic or non-traumatic. And now we have here 52 CI per patient data set. The main age was 48, but the range was very large. So from 18 that are used with the electronic system, very used, with and 77 years old that maybe are not so familiar with this kind of electronic system. So we had 79% at baseline of our patients with severe NBD score, and 21 with a moderate score. So what we found was that in all patients we have a decreased from 17.8 to 10 after 3 months of use. But we had also different results if we compare people that start baseline with moderate problem and people with severe. We have a best result in people with severe NBD at baseline, about 79% of them, with a decreased score from 19.4 to 19.9. The adverse events were all reversible events and were in 12% of patients, like autonomic dysreflexia, that maybe sometimes is also a problem of the operator, because if you try also to put some kind of anesthesia, the problem is solved. Fecal incontinence, urinary infection, but only 2%, anal pain, only 2%, bleeding, abdominal pain. But if you look not at percentage, but at the number, is impressive that about a total of 41 severe at baseline patient, they have the improvement, and only in 16 where they have still a severe NBD score. So in all patients, the mean was really improved, And this, in conclusion, is that Navina Smart is an effective treatment option for NPT, and the largest effect was in a patient with severe. We had really few reversible side effects, and only 5 patients discontinued for failure of therapy. And this system was well tolerated. From my point of view, is just a little step to the future. Thank you very much.
Are there any questions?
This is enough male incontinence. You are in the neurological world, so it's really different. But I think that maybe in the future, this kind of system can be useful in some human with constipation, also because, sorry, maybe I have to.
I have a question for you. Did all of the patients learn to do this themselves, or did some have carers assist them?
Yes, no, at this kind we choose all with they do by themselves. Also, if, as usual in the spinal unit, we give instruction also or with a relative or with someone that help them in the daily life, to be sure.
I have a question also. You said that it was a minimum of 3 months since their injury before they came into the trial. What was the longest time that someone had been using?
The longest time was more than 10 years. In my group, I enrolled about 10 patients in Florence, and the longest was maybe more than 10 years. And what we see was that the acceptance was more in the people that had a long time lesion, that if we compare with people with a new naive lesion, with a new lesion. But you know, this is really a hard period for people also to accept intermittent catheterization, because it's a revolution of their physiology. Free to go?
Yes, thank you.
Thank you.